We're at a good place at this moment to get the bill through the House. Exactly where we are is we are awaiting the response from the Congressional Budget Office and then to see what the Senate will do, and then we will take up the bill. Substance from the Budget Office, Senate action, and then the House.
What will the Budget Office tell you?
Well, whatever the budget tells us, we have to listen to, whatever the Budget Office tells us. So they will tell us one of the main reasons to do health care reform is to cut cost. And we want to cut over at least $100 billion in the life of this bill and $1 trillion in the 10 years following it. So in order to do that, we have to meet certain standards each year, and the Budget Office will tell us if we have conformed with that. If we haven't, we have to make changes.
Will we hear of a compromise between you and Harry Reid this week?
Well, the President has put forth what he has seen as the House, the Senate, listening to the Republicans, Democrats, Republicans, House, Senate, and I think what the President put on his as his proposal is what we are working around. It has to comply, again, with meeting the cutting of cost. Again, one of the main, obviously, we want our country to have quality health and affordable health care for all Americans. That's a value. But it's urgent for us to act because we cannot afford the status quo. It is unsustainable. It is unsustainable for individuals, for families, for businesses, for the federal budget, for our economy. And so we have to turn that spiral downward of ever-increasing health care costs. So again, what the President has put forth is melds together some of the ideas that he has heard, House, Senate, Democrats, Republicans, and now we have to see how it meets the standards of the Budget Office.
Fact is, the House will vote on the Senate bill. That's what's going to take place.
Well, the House will vote on a bill, two steps. The House will vote to pass this compromise. In other words, there are many issues that are important to members of the House of Representatives. Affordability for the middle class, accountability for the insurance companies. So we have to have, to ensure that this bill is affordable for the middle class, we believe the House bill goes farther to do that. Accountability for the insurance companies. We believe that the House bill went further on that. Getting rid of the Nebraska, whatever we want to call that, fix to make more equity
the deal
for
made
the
with
state.
Senator Nelson.
More equity for the states. And the fourth point would be we had disagreement with the Senate on the pay for. We believe there are better ways to pay for it than to tax the so-called Cadillac plants. So 80% of that would be gone under the proposal we put forth. Still in the out years, the ability for the 20% that is left and what is added on then to take the cost down. So we will be voting on those four things. In preparation for that, we will do what is necessary to have a foundation of the Senate bill.
There are a couple of members you can point out who are weather vane members who will tell us exactly where this might be going, if we knew where they stood on this and what reservations they had.
All of them. So you see, when I don't take a big clump and say, well, I have 200 and some, I just have to get to 218.
Right.
I start one member at a time, listening respectfully to where they're coming from on it.
Do you have the votes at this moment?
We don't have the bill yet.
So your response always, any questions about do I have the votes, is I can't tell you.
Until we have the bill.
But my guess is I can't believe, and with as naive as I am, that you don't pretty much know how close it is, what you have to do to get some people to go from here to there.
That's right.
Okay. And you hope that what comes out of the Budget Office will help you take them over there.
That's right. It's a long road, and members, and when you're talking to them, I have 256. Well, now 255.
Yeah, right.
One last.
When will it be on the President's desk? He wants it early. He said he wanted it before he went to Indonesia. That's next week.
My clock doesn't start ticking.
Maybe this week, yeah.
My clock doesn't start ticking until I see the CBO numbers come.
When will they come, though? When do they tell you?
You know what? They talk about independent,
Yes.
as well they should be.
Yes.
But they give, when they're ready, they give it to us. When we have it, our clock starts ticking, and we'll see what the challenge is. But you know what? We'll keep working, and we'll keep fighting until we have a bill, and whenever that is. Hopefully sooner rather than later.
The Speaker of the House believes health care will pass.
Yes. Today. If we took it up today.
Okay.
Yes.
It will pass. Okay. Charlie Rangel.
Well, he has done the responsible thing. He said he asked for an investigation by the Ethics Committee. They conducted it. They made one judgment on it. More is to come, but he will. But he has stepped aside, and I think that was the appropriate thing for him to do.
Should it have happened earlier?
He had a right, as every member does, to have. I wish that the Ethics Committee had acted faster, so that this wasn't so drawn out. But they had to go through their due process too, and so in any event, we have a new acting chair of the Ways and Means Committee.
Acting chair.
Acting until this issue is resolved.
And then you had two people that wanted to be that. Mr. Stark and Mr. Levin both wanted to be the acting chair. And
well, I think Mr. Stark, when he realized that in order to be the acting chair, he had to give up his chairmanship of the Health Subcommittee at a time when we're doing health, realized that where he wanted to be was with the Health Subcommittee.
Speaking of that, Congressman Massa.
Yeah, that I don't get. I don't know. He called me last Wednesday and said that he was diagnosed with cancer, that his doctor said he had to change his routine, and that he was not going to seek re-election. I sadly received the news that he was in poor health. And then Congress went out. I went on the campaign trail and came back to learn.
He's pointing the finger at you.
Really? That I missed. I haven't seen that.
He's pointing the finger at Rahm Emanuel.
I knew he was talking about Rahm, because that's not who.
Well, you knew he was talking about Rahm. Didn't know he pointed the finger at you.
No, because I saw it someplace. I guess Rahm is bigger news than I am.
No,
but
no. Okay.
But I have no idea. This is a sad case. This is a sad case.
He's now become the darling of the conservative talk radio people. Rush Limbaugh. He's on Glenn Beck.
Yeah.
A Democrat.
So what? I mean, the point is,
he was part of your.
This is a very sick person. He has been diagnosed with cancer. Perhaps his judgment is impaired because of his the ethical issues that have arisen, and he is no longer in the Congress. Poor baby. Poor baby. Sometimes we really exaggerate our own importance in a lot of these things,
Rahm Emanuel is at the swirl of this controversy. People are pointing the finger at him. There are columns being written about him. The president has given a general sort of, I'm about his staff, saying everybody's contributing without specifically referring to his chief of staff. What's happened? You know this town.
I know this town, and I know it's an archery range.
Everybody has a bow and arrow.
And when you let's take another analogy. When you jump into the arena, as I have as speaker, you become a target. If you can't take that heat, as Harry Truman said, get out of the kitchen. Well, I've spent a lot of years in the kitchen, figuratively and literally, so I recognize it well. But I also recognize it when the heat is placed on other people. Rahm is so effective, and when you're effective, you become the target. He serves the president well. That's up to the president, of course, his judgment. But by all that we can see, he serves the president very well. He's a brilliant. He's a softy. He's a policy wonk. You think of him as this tough political.
He was not hired because he was a policy wonk. He was hired because the president thought, I need somebody who understands the Congress and who's very tough.
But he also respects him for his knowledge of the issues and the values that he shares with the president on these subjects. He didn't hire a party hack. He hired a policy person who understands policy, who's astute, understands politics, who's politically astute in that respect, and commands a great deal of respect. So I have every confidence that Rahm's probably enjoying all of this.
You think?
Yeah.
Just last
question.
Let
me say, absent the most recent which nobody could possibly.
The Massa
the
stuff.
Massa. I mean, that's weird. That's weird. Poor baby.